Yes, Dr. P here from Queensland, Australia. I'm a medical practitioner, family medical practitioner. We're the dumb doctors, not the specialists. Hello. Um, just going to do a little clip here for my patients on liver function tests because we do them all the time and they're often abnormal, and then people, you show them to patients on the screen, show them what their liver function tests are, and it's very confusing. It's probably like a mechanic showing you, you know, dyno readings on your car or something. So, but doctors do them so often that you look at the LFTs, or liver function tests, you can sort of see what's going on. But the test comprises various chemicals that the laboratory measure, usually as part of a SMA 20 or a SMAC 20 or a urea and electrolytes and LFTs, or a multiple biochemical analysis. There are about 20 different names for these things, but probably the most commonly done test that we do. In the LFT area, or liver function test area of the blood test, the first chemical they measure is bilirubin, which is the yellow chemical or bile chemical that produces the yellow coloration in bile. So if you've ever had really bad vomiting and you've been vomiting up horrible yellow bitter stuff, that's bile. That's what your liver produces, pumps it into the gallbladder and then pumps it into the stomach. So your liver produces that as a waste chemical, and breaks. It gets excreted usually through the kidneys, which is why urine's a bit yellow. And if urine's very yellow, it might be that your liver's upset. So that's bilirubin. Bilirubin should be below 20. If you have some sort of liver disease, your bilirubin might rise, but we'll get into that a bit later. The next couple of tests they measure are the two probably important ones, which are called ALT and AST, which are, I think they're called alanine transferase and bloody hell, I forgot what they're called. ALT and AST, anyway, they're the two that tell you how well your liver's functioning. So if you're doing something to hurt your liver, you're taking a drug, medication from a doctor that's hurting your liver, that's harming your liver. If you've got hepatitis, which is a liver disease that harms your liver cells. If you're a heavy drinker, if you took a paracetamol overdose or something, you'll damage your ALT and AST, and they're the two important enzymes in the liver that do all the hard work. And if they're raised, then that's not good. If you're a bit of a drinker, they might be just double normal. I think they're normally about 20 to 40. In Australia anyway, that's probably in different units overseas, but they're normally about 20 to 40. If they were like 80, that might be from drinking. You might get them up to 80. If you're taking medications that are upsetting your liver, you might get them up to 80. If you've got a full-blown hepatitis A or hepatitis B, we should do a clip on those because they're important topics. They might be up in the thousands, and that's a sign you've got acute severe liver disease. So AST, ALT. They measure your ALP, but ALP is a complicated one because it's also produced by bone. Alkaline phosphatase, I think that one's called. That one gets raised if you've got a blockage in the actual conducting systems, the little tubes that leave out of your liver through your gallbladder and into your stomach. So if your ALP is very up, might be that you've got a stone in your gallbladder, or a stone in your bile duct rather, or maybe even something in your pancreas. So if your liver tests are up, but ALP was particularly up, they'd be looking at that sort of area. And then your gamma GT, which is another one. It's a bit like ALP because it goes up if you've got a blockage. If you've got a bile blockage somewhere in the liver, but it also goes up. People who take virtually any chronic medication, if you take chronic sleeping tablets or chronic painkillers or chronic epileptic drugs or just about anything that gets broken down the liver, your gamma GT will go up. It also goes up in alcohol. It's a good test to see if you're drinking too much booze, if your GGT is too high. So doctors look at all five of those, and you can sort of make an analysis on whether you've got a blockage in the liver, or damage to the liver, or the bilirubin's up because something is driving that to be up. So newborn babies they're breaking down red cells and their liver's not quite mature enough, they'll have a very high bilirubin, which is why they sometimes go yellow. That's another topic for another day. But that's just a basic breakdown on the five separate tests that are used to assess liver function on a liver function test. Thank you.